Assalamualaikum dear doctors. In this video I am discussing a syndrome that is a short stature syndrome. So when we enter in the exam hall we find a short stature patient and we know that one of the differential diagnosis of short stature female is Turner syndrome, which is 45X0 chromosome. Look the image of the child. See the girl is short, there is white space nipple, wide carrying angle, and she is female. There is also a seeing short neck, web neck, lymphedema. There is a short finger of the fourth and fifth metacarpal bones, also low posterior hairline and short neck. So feature of Turner syndrome. Turner syndrome is 45X0 chromosomes. There is webbed neck and short stature, small mandible, high arched palate, low set ears, low hairline, and on the minimum breast development. There is bicuspid aortic valve, coarctation of aorta. There is diagnosis by karyotype. Ovarian dysgenesis, so there is amenorrhea and infertility is present. Lack of pubic hair is present. We find short fourth and fifth metacarpal bones on the image we see, widely spaced nipples also we see, and lymphedema of the hands and feet. When we enter in the exam hall, we find general observation a short girl. Then the vitals maneuvers. What are the maneuvers? Number 1, put your hand in front of you, hyperconvex nail. Number 2, make a fist. There is short fourth and fifth metacarpal bone. Number 3, make a star. Short fourth and fifth fingers. Then number 4 is put your hand in front of you and together, that is symmetrical. Number 5, put your hand on your thigh, normal. Number 6 is put your hand besides you, that is cubitus valgus, wide carrying angle. Number 7, flex your elbows and touch the shoulders with your thumb, that is normal. And number 8 is back and back of the neck, low hairlines and web neck. So these are the maneuver we do and we find. Now the targeted general examination, that including in pulse. Number 1 pulse, we find 3D weak pulse. There is delayed radiofemoral permissions, delayed radial delay. So radiofemoral delay will not take need to permissions. There is delay radial delay. We know that the cardiac disease coarctation of aorta is associated with Turner syndrome. Number 2, on axilla we will find delayed puberty. There is no axillary hair. Number 3, head and neck. We find high arched palate, goiter or not. Number 4, on chest we can find scar for heart surgery, shield chest, widely spaced nipples, hypoplastic nipples, capulate lesions. So chest is very important in Turner syndrome. Then number 5, back. So back from the upper we start the examination. Low hairline we find, low set ears. There is short web neck. And number 6, auscultation we find murmur for coarctation of aorta. Number 7, I would like to complete my examination by measuring the forelimb blood pressure. Number 8, I would like to ask the mother about history of lower limb edema in the neonatal period, special school hearing assessment or having hearing aids. So lower limb edema on the neonatal period is present. Now about the management plan of Turner syndrome. First, history I would like to take a full history. Then investigations, diagnostic karyotype 45X0. Lab we do the thyroid function test, random blood sugar, sex hormones. There is increased FSH, LH and decreased estrogen level, and we find hypergonadotropy, hypogonadism. Number 4, autoimmune disease screening, that is celiac disease, inflammatory bowel disease, diabetes mellitus and vitiligo. And imaging we do the echocardiography, bicuspid aortic valve and coarctation of aorta. Abdominopelvic ultrasound, we can find horseshoe-shaped kidney and streak ovaries, and ultrasound on neck for goiter. Number 6, hearing assessment for glue ear. Now, what are the multidisciplinary team we involve? These are genetic, cardiology, nephrology, ENT, because sensory neural hearing loss present. SALT, that is speech and language therapist, ophthalmology, dietitian and GIT for celiac, endocrine for diabetes mellitus, hypothyroidism, growth hormone for short stature, estrogen for secondary sexual characters, liaison with the school, bullying, learning difficulty, and educational psychologist and psychological support to the family. Next question, what are the endocrine problems is associated with Turner syndrome? These are short stature, delayed puberty, hypothyroidism and type 2 diabetes mellitus. Treatment of Turner syndrome, we give growth hormone and estrogen. About the complications of Turner syndrome in heart, that is bicuspid aortic valve, coarctation of aorta, renal, horseshoe-shaped kidney, GIT, celiac disease and inflammatory bowel disease. Endocrine is hypothyroidism and ovarian agenesis. Hearing is chronic suppurative otitis media and sensory neural hearing loss. Malignancy, that is gonadioblastoma, can be developed. How can we screening or follow up Turner syndrome? Number 1, all. Echo, renal ultrasound, audiology, spine X-ray and pubertal assessment. 0 to 4 years, we do the hip examination, DTH and ophthalmology. 4 to 10 years, we do the thyroid function test, celiac screening, and orthodontic evaluations. And more than 10 years, we do the thyroid function test, celiac screening, ovarian function evaluation, RBS, LFT, RFT, and DEXA scan. So this is all about Turner syndrome.